Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de toda Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de toda Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de toda Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de toda Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Buenas tardes a todos. Tengan bienvenidos a este curso relacionado con el área de la medicina. Welcome everybody. Vamos a empezar con este curso. Me voy a presentar. Mi nombre es Rubén Hernani Machicado. Yo soy el encargado de dar este curso por el día de hoy y el día de mañana. Ok, el curso tiene una duración de 2 horas y media. El día de hoy y el día de mañana. Bueno, hablemos un poquito acerca de mi experiencia. Vamos a hablar después un poquito acerca de lo que tenemos que hacer para los certificados y luego comenzamos con el curso. Ok, bueno, como les indiqué, estoy eh, con más de 19 años de experiencia trabajando en el área de inglés. He trabajado en varias instituciones en las cuales no solo he trabajado como profesor de inglés, sino también como coordinador tanto regional de la ciudad de La Paz. También he sido coordinadora nacional a toda Bolivia, encargado de varias instituciones de diferentes ciudades de Bolivia. También he trabajado en otras instituciones como profesor y también como director académico en el área de inglés, sin dejar de lado, obviamente, el trabajo que realicé en colegios, ¿verdad? Como puede ser el Sagrado Corazón de Jesús también. Bueno, esa es mi experiencia laboral. Tengo bastantes años trabajando con el idioma inglés. Y bueno, pues estamos ahora con el seminario relacionado con el área de medicina, obviamente en inglés. Bueno, muchísimas gracias por dejarme presentarme. Vamos a continuar. Primero que nada, dar la bienvenida a todos. A todos. Indicarles que estamos a punto de comenzar y por favor a todas las personas que están ya en el curso, pedirles amablemente que puedan comunicarse con los números de VirtuallCorp. ¿Para qué? Para que puedan ustedes dejar sus datos y así puedan obtener los certificados relacionados con el curso. ¿Ok? No se olviden, por favor, hacer esa comunicación con los números que están obviamente en pantalla en YouTube. Así pueden ustedes directamente coordinar para la entrega de los certificados, obviamente, y dejar todos sus datos. Vamos a establecer algunas reglas en el curso. Primero que nada, este curso es muy participativo. Me encanta hacerlo participativo porque esa es la mejor forma de poder aprender. Y obviamente va a ser en inglés. Estoy haciendo una breve presentación en español, pero va a ser todo en inglés en cuanto comencemos, ¿ok? Asimismo, cualquier consulta que ustedes deseen realizarla, simplemente lo pueden hacer escribiendo en el chat de YouTube. Así yo voy a poder leerlos y poder responder a cualquier inquietud que ustedes puedan tener. Bueno. Y también les voy a pedir, por favor, que en ciertos momentos puedan participar escribiendo en el chat de YouTube. Entonces, por favor, les pediría muy encarecidamente que empiecen también a escribir en el momento en que yo les pida, ¿ok? Bueno, un saludo a todos. Estamos aquí con varias personas. Veo a Paula Vega, Anaí, Alma, Valeria. Buenas tardes a todos. Un placer poderlos ver y bueno, pues vamos a comenzar. Entonces, empezamos. Well, we're going to start working with the English course for the health area. And well, what are we going to do in this course? First of all, I have to talk about the main goal. What is the main goal of this course? Obviously, to develop the English linguistic skills for you to work effectively in medical and hospital settings. Yes, obviously emphasizing the technical vocabulary, clinical communication, and documentation. So, in this way, at the end of this course, you will be able to work effectively and with all the necessary skills that you need to speak in English related to the medical area, okay? That is what we will do at the end of this course. Well, let's continue. What are the subject that we have to develop in this area? Okay, we're going to talk about the technical English for the healthcare area, medical vocabulary and body systems, clinical communication skills, reading and interpreting medical records, emergency situations and first aid vocabulary, hospital and clinical environment, medical documentation and writing. And well, we will do all these subjects in these 2 days. That means that we will start with the first one, technical English for the health care area. But as I told you, I need your participation. So every time I ask you to participate, I will be very happy to have your responses by the YouTube chat, okay? Thank you very much. Well, let's start with the technical English for the healthcare area. Well, the goal of this subject is to familiarize people, you, related to the medical area with the most common anatomical vocabulary in the English healthcare. When we talk about the anatomic vocabulary, we are talking about all the body parts, right? Well, we need to understand something very important, okay? And this you must know. The medical area, the healthcare area is very wide. It's very big. So in order to work with all the medical area, we would need more than 2 days. But what we will do today and tomorrow is to work with the most common vocabulary related to the healthcare area, okay? But it doesn't mean that we are not able to do something else. If you have a question or if you have a word that you need to know, obviously in English, just write it on the YouTube chat, and I will be very happy to work with it. Okay, so telling that, let's start working with that. Okay. Well, first of all, let's go to the body parts. We're going to divide the body parts in 3. You know, the head, the trunk, and obviously the legs and arms, okay? So that is what we will be working first. Now, let's start working with the head. Obviously, we're going to have a lot of instructions related to the head, okay? First of all, I'm going to start working with you using my body. Why? Why do I need to use my body? Because the most important, the easiest, and the fastest way is to learn by your eyes and touching, right? Please, if you can do the same as I do, it will be great for you. First of all, let's talk about the head. The head is all of this, right? The head. All of this is the head. So, the head. Let's continue with the hair. The hair is what we have here. Some of us we have in black, some others in blonde, some others in brown. So this is the head, right? The one that you comb. That is the hair. Let's continue. The nape. What is the nape? The nape is the back part of the head. This is the nape. The nape, right? The nape. If you can see, that is the nape. The nape. Okay. Let's continue. What is the crown? The crown is that little part that we have here in the middle of the head, in which the hair starts growing like in a circle, right? That this part, just in Spanish, you may say like a corona or coronilla, right? That is the crown, okay? Let's continue. Then comes The forehead. What is the forehead? The forehead is this part. This part. This part, okay? The forehead. The forehead is this part. Let's continue. The bride of the nose. What is the bride of the nose? The bride of the nose is this part. This specific part, okay? The bride of the nose. Here, the bride of the nose, okay? The bride of the nose. Let's continue. We have obviously the nose that you already know, the nose, right? Nariz. Let's continue. The nostril. The nostril is the hole that we have in each side of the nose. I mean the nostrils, okay? The nostrils. That is lips. Lips, we have the lips here in the mouth. The lips, right? Those are the lips. But we need to know that this is the upper lip, and this is the lower lip. Upper lip, lower lip, okay? That it is. The chin, this is the chin. If you can see, this is the chin. The chin, okay? What is the jaw? The jaw is this part. This part, the jaw. Well, in Spanish, it should be mandíbula, right? That it is, the jaw. We have another ones. Face, for example. The face is all of this, the face. Then comes the cheeks. These are the cheeks. The cheeks, okay? Cheeks. These are the cheeks. Then comes the eyes. The eyes, right? The eyes. You already know the eyes. But we have something else. The eyebrow. The eyebrows are this part. The eyebrows. The eyebrows, right? The eyebrows. Then comes the eyelids. The eyelid is this. Well, the eyebrows should be this, cejas, and eyelid should be párpados, right? So the eyelid, 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 okay? Then comes the eyelashes. The eyelashes are the ones that you have here that stops that any kind of drops could get into the face, into the eyes, right? So that is the eyelashes. Eyelashes would mean in Spanish pestañas, okay? Then eye bags. What is the eye bag? The eye bag is that little bag that we have below the eye, right? Below the eye. This little bag is the eye bag, ojeras, right? The eye bag, the eye bag. Then we have the ear, the ear, the ears, 2 ears, okay, ears. We have also the mouth. We already talked about the lip, but we are going to talk about now the mouth. The mouth is all of this, right? All of this. Don't forget that you need to be touching what I am telling you. That is the best way to learn, okay? The mouth, the mouth. Inside the mouth, we have the tongue, tongue, tongue. And obviously the tooth. The tooth is one, only one tooth. Tooth, but if you want to talk about it in plural, it becomes teeth. Teeth is dientes, tooth is diente, okay? So you have all of them as tooth, okay? So those are the parts of the head, okay? So I will go again with you. Please don't forget to do the same as I'm doing, okay? That is the best way to learn. First, head, then comes hair, then we have the nape, the crown, the crown, forehead, forehead, the bride of the nose, the bride of the nose, the bride of the nose, the nose, nose, nostrils, nostrils. Then comes the lips, the upper lip and the lower lip, chin, chin. Then how about the jaw? The jaw. Okay. The face, all of this is the face, the face. Then comes the cheeks, 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 cachetes, right? Cheeks. Then comes the eyes, eyes. We have the eyebrows, eyebrows, eyelid. The eyelid is this, the eyelid, the eyelids. Eyelashes, 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 pestañas, the eye bags, the eye bags, the eye bags, the ear, ear, ear. Then we have the mouth, mouth, all of this, mouth, tongue, 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 and obviously the tooth. One tooth, all of them teeth, okay? Teeth. That it is. Well, you may ask yourself why this person, why this professor is repeating all the time the parts of the body. Well, we cannot. I am not able to listen to you, so I am repeating so you can memorize the parts of the head. Okay, so this is what I am doing to make you memorize all the parts of the body. Obviously, before we continue, if you want to have all the material that we are using in this course, just have to talk to the person in charge by the chat by the chat. Sorry, to the person in charge in the phone numbers that you have in the YouTube. So and they will be able to give you all the material. Okay, so let's continue. Now that's the way I'm repeating all the time, 2 or 3 or 4 times, because I really need you to memorize everything. Okay, so thank you very much. Let's continue. Let's continue. Let's go to the eye. Okay, in this case we have the iris. Iris, you know what iris is. I cannot point it with my finger, but I will show you here the iris. Then comes the pupil, the little circle, pupil, sclera. Sclera is the white part of the eye, sclera. Okay, sclera. And then the conjunctiva. What is the conjunctiva, you may ask yourself? Well, this is not very clear, but you have some little lines, red lines in the surface of the eye. So those little red lines are the conjunctiva. Okay, so that it is. So again, the iris, the pupil, sclera, and the conjunctiva. Okay, so those are the parts of the eye itself. Okay, let's continue. Let's go now to the body. Yes, it's time to work with the body. To talk about the body, we have the neck. This is the neck, right? And I will start working with you, showing the parts of the body in this picture. Okay, so the neck. This is the neck. Okay, then comes with the shoulders. Only one, a shoulder, in plural, the shoulders. Where are the shoulders? These parts, right? These parts, the shoulders, shoulders. Then comes another one, which is the chest. What is the chest? This part is the chest, okay? The chest. This part, the chest. Let's continue. Breast. Breast is something similar to the chest, but it's just for women. Okay? The breast is just for women. In Spanish should be senos. Okay? That is just for women. For man should be chest, right? Pechos. Okay? So that is the difference, just in case. Just in case. Then we have the abdomen. Abdomen. And I have to emphasize something. I will make you, I will tell you something very easy so you can make in your mind the pronunciation starting so you can do it easily. In English, it's very difficult to have the stress of the word at the very at the end of the word. So I cannot say shoulder. No. In English, we don't have that elevation of the voice or the tone or the stress, if you want to know that, in the last syllable. No, we don't have it in the first syllable, let's say. We have always before it, for example, shoulder, not shoulder, shoulder, abdomen, abdomen. I cannot say abdomen, right? So this is something that it will help you very much, because in that way you will understand better. I will tell this in Spanish so you understand me. Cuando tengo una palabra en inglés, generalmente yo no tengo la acentuación, si es que puedo decir así. La elevación de voz es preferible porque no hay acento en inglés. La elevación de voz en la primera sílaba, acá, no puedo tenerla, o al final de la palabra, no puedo tenerla. Generalmente se tiene antes, shoulder, abdomen, ¿ok? No tengo al principio, no puedo decir shoulder, abdomen. ¿Por qué? Porque generalmente estamos acostumbrados en español a colocar el acento en la primera sílaba, en este caso, ¿verdad? Acá, no la penúltima ni la antepenúltima. Entonces, pese a que tenemos, pero generalmente va así. En inglés no tenemos la elevación de voz en la primera sílaba, okay? So, take into account. In that way, it will be easier for you to pronounce the English words, okay? So, let's continue. Then we have the waist. What is the waist? The waist is that part in which men, we have it like just in a line, and women, we have in a curve, that is a waist. In other words, it should be a cintura, right? Waist. Then comes hips. And I'm sure that everybody knows because of the word, the song of Shakira, that make it very popular. So hips don't lie. So hips, you know what hips mean? Hips means caderas, right? Hips, caderas. Back. What is back? Back is the back part of your body, being redundant. So that is espalda, right? So back, the back. Let's continue. We have the arms. The arms, but in a general way, arms. We're going to go deeply in a moment, okay? So until here, we have all of the trunk done, okay? I'm telling you this in the general part. The internal part is going to be later on, so don't worry. So again, just to let you know about the pronunciation: neck, neck, shoulder, shoulder, chest, chest, breast, breast, abdomen, abdomen, waist, waist, this part, hips, hips, back, back, and arms, arms, okay? That is the most important part, okay? Now that is already done, let's continue with the next presentation. That means that it talks about the arm itself, okay? So we need to know that this is the arm itself. All of this is the arm itself, okay? All of this. Now, what about the upper arm? The upper arm is this part, the upper arm. In other words, this is in the picture. You have here the upper arm, okay? Then we have the bicep. This is the bicep, right? Bicep. Then comes the elbow, There's a little point here. The union between the upper arm and the forearm is the elbow, okay? Now we have the forearm. The forearm is this part. The forearm is this part. The forearm, this part, right? Then comes the wrist. What is wrist? Is this. Wrist, wrist, wrist. In Spanish should be muñeca, okay? And I have to emphasize this. For healthcare vocabulary, wrist is the correct word, not doll. Aquí siempre hay una pequeña confusión. La muñeca es wrist, no es doll, pese a que tiene el mismo digamos, significado en español, muñeca, doll, pero se refiere a dos cosas diferentes, muy diferentes. So, wrist is the correct one. Wrist, okay? Wrist. Hand, you know the hand. I think it's not necessary to emphasize hand. Then comes the palm. Yes, this is the palm. This is the palm. This is the palm. All of this. Palm. In the picture, this part. Let's continue. Fingers. You already know the fingers. We have 5 fingers in each hand. 5 fingers in each hand. But each finger has a unique name, a proper name. The thumb. This one is thumb. That's how it comes the expressions thumbs up or thumbs down. Thumbs up, thumb down, right? So that is the expression. Viene de ahí. So pulgar, thumb, okay? Then comes the index. This is the index. Index, okay? Index. That is the index. What else? Then comes the middle finger. The middle finger, okay? The middle finger. The middle finger. If you want to know, the other medio, right? The middle finger. That it is. Then comes the ring finger. This is the ring finger. Why ring finger? Because generally here is where the ring of the marriage come, right? When you get married, you introduce a ring. Where in this finger. That's why the name of this finger, ring finger, okay? Ring finger. Then comes the little. This is the little finger, the little finger, the little finger. Okay, the little finger. the correct name is little finger, but also there are some people that tells to this finger the pinky finger. Yeah, and it's necessary for you to know all the vocabulary and obviously the extra words, let's say, that you need to know, the sayings, right? Um, the colloquial name of these words, of these words, yeah, of these names, if you can understand. So is the pinky, and from here, from this little finger comes the pinky promise, the pinky promise, right? This is the pinky promise, la promesa que se hace haciendo esto like this. The pinky promise comes from this pinky or little, okay? So that it is. And finally, obviously, the nails. What is the nail? The nail is the last part of the finger which you cut it every time it grows, right? So, las uñas, right? Those are the nails. Well, that is those are. I am forgetting. This one, el puño, is the fist, puño, fist. And these each ones of these parts, I don't know if you can see in my hand, these parts in the picture, these are the knuckles. What is knuckles? Nudillos, okay? Those are the knuckles, okay? So, I'm gonna start again working with the pronunciation. Just follow me, okay? Follow me. Where you are, donde están, síganme, okay? Touch your body. The upper arm, bicep, elbow. This is the forearm, wrist, hand, fingers, palm, damp, index, middle finger, ring finger, little finger or pinky finger, okay? Fist, and knuckles, okay? Knuckles. So that it is. Finally, the nails, okay? Nails. Those are the parts of the arm, okay? Let's continue. Let's continue now with the legs. First, we have the buttock. What is the buttock? The buttock is nalga, okay? The buttock, nalga, buttock. We have the leg. Sorry, we have the leg. Which is the leg? All of this, the leg, right? The leg. But we divide the leg in some parts. For example, the thigh. The thigh is this part, the thigh, this part, the thigh, okay? Thigh, muslo, right? Then comes the knee, that most of you may know. Sorry, I'm gonna drink a little bit of water, okay? Thank you. The knee, this is the knee. If we go to the to the back part of the leg, we have the calf. This is the calf. The calf. Well, there are many ways to say the calf in Spanish, right? I don't know how to tell this in Spanish. Tal vez me puedan decir cómo se dice calf in Spanish por el chat de YouTube, por favor. If you can tell me calf. I know like gemelos. Some people say gemelos. I don't know. So maybe that word would be great. This is okay. Now we have the calf. Then we continue. We have the shin. What is the shin? Shin is this part, okay? This part, the shin. Shin. We have then the ankle. What is the ankle? The ankle is like this little part, right? The ankle, this little part that we have on the foot, the little part, right? Then comes the heel. This is the heel. This part, the heel, okay? And the sole. What is the sole? The sole is la planta de los pies. Sole, okay? Obviously, we have the toes that everybody must know. Toes, los dedos de los pies are toes, okay? So, all of them. All of them. Now, that it is, okay? So, those are the parts. Again, leg, first buttock, leg, tight, knee, calf, shin. Shin maybe in English is, yeah, tobillo, yeah, very good, pantorrilla, very good. Excellent, pantorrilla, tobillo. Ankle, tobillo, right? Pantorrilla, very good, thank you very much. Heel. What is heel? Tell me, what is heel? Women may know because we use a lot of, they use a lot of heel shoes. Heel shoes, right? So heel would be talón, right? Very good, Alejandro. Thank you very much. What about the sole? I already told you, sole is the planta, right? The planta de los pies. Thank you very much. Well, obviously we have also nails in the toes, right? So it's not necessary to repeat. So those are the parts of the body. Now I will continue working with you again. Buttock, leg, tight, knee, calf, shin, ankle, toe, sole as well, right? Sole, and finally heel, okay? So all of them. That it is. Let's continue working with this. Until here, we have already finished with all the physical vocabulary and the outside physical vocabulary. Now let's deal with internal organs. Okay, that is very important. Yes, it is. Obviously, as I am telling you, there are many other parts that maybe if you have some specializing degree, you may know, right? But let me tell you the general way so you can communicate effectively with any patient in case you need to talk in English, okay? So let's continue with the human organs. The brain, that is the most important organ of the body, right? The brain, right? The brain. Then we have the heart, right? heart. Then comes lungs. The lungs are the parts the organ that we use to breathe, to have a deep breath, right? We introduce air to the lungs. So what is lung? Who can tell me what is lung? Please, you can write on the chat what is lung, so everybody can know. Tell me what is lung. We have two, the lungs, right? So if you can write on the chat, it would be great. Would be great. The lungs, right? Then comes the liver. The liver. What is the liver? Do you know what the liver is? Please write it in the chat. According to the picture that I'm showing to you, this is the liver. This is the liver. The liver is here. So what is the liver? Liver in Spanish. And obviously what is lungs in Spanish? If you can write, I will be very happy to read it, okay? So the liver, okay? Then comes the stomach. And this is something very important I have to tell you. The pronunciation of stomago in English is stomach. It's not a stomach, okay? A lot of people pronounce in that way stomach, but it is not. It is with K, stomach, okay? This is the correct pronunciation. So then comes the kidneys. What are the kidneys? Kidneys. Kidneys. Do you know the kidneys? Well, I will tell you in a minute. I'm waiting for you to write down in the chat, please, of the YouTube. Please write it in the YouTube chat, please. Then we have the intestines. Yes, the intestines. We have two, right? Two, the large intestine, and the long intestine, okay? So the large intestine is the big one. I mean, the big one. And the long intestine is the narrow one, okay? That is the two kind of intestines. And finally, we have the bladder. What is the bladder? The bladder is the down part of your stomach in which you got the urine, so you can go to the bottom and pee, right? So that is the bladder. We have another one, which is the thyroid, la tiroides, okay? So that it is. Those are the most important organs of the body, okay? So let's start again. Brain, cerebro, right? Brain, cerebro. Heart, corazón. Heart, corazón. Then we have lungs. Lungs means pulmones, right? Pulmones, okay? So what about the liver? Liver means hígado, right? Liver, hígado. The kidneys are the riñones, right? Riñones. Kidneys. Stomach, you know, the stomach. Intestines, yes, the large intestine, intestino grueso, the long intestine, intestino delgado. Thyroid, tiroides, and the bladder, you know, the bladder is this part, right? Vejiga, okay? And obviously, we have the last part. Well, in men, we have the penis, right? The penis. So that it is. Now, I will repeat one more time just in case you forget the pronunciation. Please, you need to understand that we are working in this seminar, in this workshop, let's say, let's talk about it, in order to learn the pronunciation of the body parts as well. So you need to know that. So brain, heart, lungs, liver, please, it's not liber, no es liber, con la B labiales, con la B dentilabial, liver, okay? Kidneys, stomach, no es estómago, no con la E, con la S, stomach, okay? Intestines, the large and the long intestines, thyroid, bladder, okay? Thank you very much. It's important also to know some basic anatomical terms. Sorry. Let's talk about the directional terms, okay? We can say anterior, that it becomes, that talks about the front, the anterior or the front, okay? It's the same as saying front. Solo en inglés, solo para el área de salud es anterior, okay? Please don't forget that. Posterior or back, posterior, right? Superior, that means above, superior, above, okay? We have also inferior or below, lateral, that means the side of the body, lateral. Then comes the middle, el medio, the middle, okay, the middle. We have lateral side, as again is repeated. The proximal, right? Proximal means proximal, very close to proximal, right? Now, those are the directional terms. So I will talk to you again one more time. It says anterior, posterior, superior, inferior, lateral, medium, and proximal, which means anterior front, posterior back, superior above, inferior below, lateral is the side, medium, the middle is el medio, the lateral is obviously side, and the proximal, okay? And you can see here the right, la parte derecha, and left, la parte izquierda, right? And if you can see this little picture, we also have all these words here: anterior, posterior, proximal, distant, as well, distant, the cranial part, la parte craneal, right? Or the caudal, maybe, right? So, we have also the sagittal plane, the coronal plane, and the transverse plane. So you may ask yourself, what is that? The transverse plane, el plano transversal, right? And you use a lot of that. It's like a cut that you have. Imagine that you have a plane and you cut the body like this. You cut the body like this horizontally. So that is the transverse plane, el plano transversal. So you can see, right? What happens if you cut the plane like this? Like this, from here like this. If you cut it, that becomes the sagittal plane. The sagittal plane. When you cut here like this, you have a cut it here, that is the sagittal plane. And the other part is the coronal plane, where you cut the body like this. That is the coronal plane, okay? Now, what are we using this for? We have some examples. I can say, for example, the chest is superior to the abdomen. Talking about the first words, right? What else? The fingers are distal to the wrist. The skin is superficial to the muscles. Muscles, by the way, músculos, muscles, is not muscles, muscles, okay? And the heart is medial to the lungs, medial to the lung. So those are the some examples that I can tell you about these directional terms, and obviously the other ones, okay? The planes. So I hope you understand. I will talk to you about the pronunciation one more time. The sagittal plane, coronal plane, and the transverse plane. Okay. Thank you very much. So let's continue now. Until here, we have already finished with the body parts. Acabamos de terminar con las partes del cuerpo. Okay. Why are we learning this? Because as doctors, I mean, you need to know all the body parts in English so you can talk effectively with your patient, right? And we're going to check it later on. Let's talk about some other basic anatomical terms. Let's start with the prefixes and suffixes in medical English, okay? What is a prefix and what is a suffix? The same as in Spanish. The prefixes are a group of letters, un grupo de letras, that we add at the beginning of a word. Okay? That's why it says prefix, pre, right? And we also have the suffixes. The suffixes are as well a group of letters that we add at the end of a word. In this time, it goes at the end of a word. En pocas palabras, en Spanish, el prefijo siempre va antes de la palabra, se une a la palabra del anterior. Y el sufijo se une después de la palabra, la parte final, okay? And here we have some examples. This is the first one that I have. That means art, that is articulación. Articulación in English, the joints. Osteo becomes a prefix. Osteo means bone. Osteo, hueso, right? And iris means inflamación, wounding, right? So in this way, if I use arthritis, means inflamación de las articulaciones, right? And osteoarthritis is the inflammation of the bone joints. Es la inflamación de las articulaciones del hueso, right? Osteoarthritis. And in that way, we can learn many more. Let's start with the prefixes. Wow, we have a lot and we have more. So the first prefix that I want to talk to you is the cardio. Cardio, it is related to the heart, right? Heart. Cardiology, cardiology. It's a word in English. Cardiología, the study of the heart, right? Cardiology. Cardiogram, cardiogram. What is a cardiogram? A cardiogram is a little, let's see, it's a picture of the heart, right? The cardiogram. Neuro, neuro. It's not neuro. Neuro in Spanish is neuro, in English is neuro. It has to do with the nerves, right? It has to do with the nerves. Neuro is like neurology, the study of the nerves. Neuropathy. The neuropathy is an illness of the nerve, una enfermedad, right? Neuropathy. In Spanish should be neuropatía, right? Derm. Derm. What is derm? It is related to the skin. The nerve is related to the skin. For example, dermatology, dermatitis. Ah, okay. What about hyper? We also have hyper. Hyper is excess of. Excess of means a lot of. Okay. Hypertension, hyperglycemia, right? That is, again, hyperglycemia, and that is good, right? So we have all these words. Hypo, it's the opposite of hyper. If hyper is excess, the hypo is the lack of, la carencia de, debajo de is hypo, okay? Hypo. For example, hypothermia. That means that your term is not in the good way, so that's why you have hypothermia or hypoglycemia, right? Hypoglycemia. Let's continue. We have this ante or anti, it's before, in front of, antepartum, before birth, right? I have another one, which is the hippo, for example, epidermis, right? Happy. What is happy? Upon, over, above, encima de. Epidermis is the outer layer of the skin. The epidermis is the outer layer of the skin, the skin, and it comes from happy, that means above, encima, over. Hypodermis. Hypo, below, deficient, hypotension. Inter, what is inter? Between, intercostal, right? Intercostal, that is inter. Intra means within, within. Intravenous, intravenoso, in the vein, inside, that is intra. That's why it says within, right? Within a vein. Peri, around. Peri, that means around. I can say, for example, the pericardium. What is the pericardium? The membrane that you can find around the heart. The peri, right? So just that. As simple as it is. Pericardium, membrane around the heart. Okay? So those are some prefixes that we need to know. But we have more. Yes. Look at all these prefixes that we use. So by is two, means two, double. Bicuspid, having two cusps, right? Bicuspids, having two, as I told you, two cusps, right? So that it is. Let's continue. Micro, that means very small, by very small. Microscope, right? Microscope. It's in charge of checking small things. Multi, that means a lot of, many, various. Okay, multinuclear, having many nuclei. Okay, nuclei. So many. But poly as well means many and much. For example, polymyositis, right? Polymyositis. That is the inflammation of many muscles. Polymyositis, right? Polymyositis. Okay? Having many nuclei, right? Now, let's continue. Anti. What is anti? Against. Against. Okay? Against. You need to understand that anti means against. Right? Against. So that's why it's very difficult to have people that talks about it, right? Let's continue. I don't know if we are here. Sorry, I think I go. Yeah. Now anti, right? Against brady, like bradycardia. What is bradycardia? Slow heart rate. This, it's a bad and difficult, painful, dysfunction, impaired or abdominal function, right? So that it is. Now, we also have the neo. This is very used, neo, okay? Now, that means neonatal, pertaining to the newborn. Tachi means fast, very rapid. Now, what have here? Taki. It's not tachi, please, it's taki. Taki means, like, for example, fast, very fast, rapid. Tachycardia, right? Tachycardia, rapid heart rate. And the last one, trans, across, that means across. Transdermal, through the skins, a través de la skin. Okay, so that it is. So I will repeat for you one more time. Bi, micro, multi, poly, anti, brady, des, neo. Yes, tachy, and trans. That it is. So I hope you understand very well these little prefixes, okay? Let's continue. Now we have some suffixes. Let's go to the suffixes, okay? When we talk about itis means inflammation. Gastritis, gastritis, arthritis, It is, as I tell you the first one, right? Ology, what is ology? What is ology? Ology means the study of. For example, biology. It's not bio, okay? Bio is in Spanish, biology, no. Biology. Pathology. Oh, that is how to work with the sickness, right? The pathology of the sickness. Let's continue. What is actomy? Actomy, don't forget that the suffixes are the ones that we use at the end of the word. Please don't forget that. What is the actomy? Actomy is surgical or removal. Appendectomy. When you take the appendix out, right? Appendectomy. Another one. Tonsillectomy. Actomy. Okay. The other one is the potty. It's a disorder, means disorder or disease. For example, neuropathia, right? Cardiomyopathy. Oh, very good. Cardiomyopathy, right? Here, gram, we have another one, gram. It's to record, to test. Electrocardiogram. Mammogram. This is something very common, right? Osses as well. What is osses? Osses is the abdominal osses is the abdominal condition or disease. Example, cyanosis, right? Cyanosis, right? What is that? You have there the discoloration of the skin, right? Or maybe the tuberculosis, okay? We have another one. It's oma. What is oma? A tumor or a mass. Example, carcinoma. If you realize I'm not stressing the last part of the word. I'm not saying carcinoma, no, carcinoma. It's a cancerous tumor, right? Glioma. It's a tumor of the glial cells in the brain, right? That you already may know. Another one that is very common is the ria. There's another suffix. What is the suffix? Flow or discharge. Flow or discharge. Rhinorrhea, right? Rhinorrhea. A runny nose, rhinorrhea, right? Runny nose. When you start bleeding, plick, that is bleeding, okay? And the most common, diarrhea, when you have a stomach problem, right? Then we have the urea, right? Urea. For example, the hematuria, the blood in the urine, or maybe glycosuria, that could be obviously the glucose in the urine, right? What is urine? When you pee, urine, right? Urine, okay? Urine, right? So let's continue. We have more suffixes. Yes. Otomy. It's a surgical incision. Example, tracheotomy. That means an incision in the trachea, right? And that is the way we use the otomy, tracheotomy, okay? The other one that I have as an example here is thoracotomy, the incision into the chest wall, the thorax, right? Ostomy is another one. What is ostomy? Ostomy is a surgical creation of an opening. Colostomy, colostomia, right? Colostomia, right? Creation of an artificial opening in the colon. An artificial opening, what it means? Colostomia, right? Tracheostomy, a creation of an artificial opening into the trachea. It's different with the otomy. The otomy is an incision, a surgical incision. The ostomy is the creation of a hole, right? That it is. Plasty. We have another suffix, plasty. What is plasty? Plasty is a surgical repair. For example, rhinoplasty, right? When you make your nose fix, right? Another one could be arthroplasty, right? Arthroplasty, surgical repair of a joint, right? The arthroplasty, that means when you fix an articulation, if I can say that, is not the correct word, but I can use it in order you to understand me, para que me entienda, okay? The joint. I have another, and that's the scopy, okay? The examination means examination, a visual examination. Endoscopy, the visual examination of the inside of the body. Colonoscopy, the visual examination of the colon. So oscopy means examination. Also, we have algia or dyna. For example, myalgia. It's a pain, the muscle pain, the myalgia, right? Gastrodynia, the stomach pain, the stomach pain, gastrodynia, right? Another one, synthesis, a surgical puncture to aspire fluid. Amniocentesis, aspiration of the amniotic fluid. So synthesis means aspiration, to aspire, okay? Well, I have more, but this is important because I'm gonna make some exercises with you in order for you to start creating, okay? So be focused, because we will use all of them as an examples, okay? As examples. So the next one is graph. What is graph? It's an instrument for recording. Example, electrocardiograph is the instrument, right? The electrocardiograph. The ECG machine, the angiograph, machine for recording blood flow, right? Angiografía. Graphy, process of recording. That is the process. Graph is the instrument, and graphy is the process. Radiography, right? I have another one. The list is destruction or separation. For example, the destruction of the red cells, there's that hemolysis, right? Chemolysis, autolysis, self-destruction of cells, right? Let's continue. We have another one. Malacia, right? Malacia. Softening, right? Softening. Osteomalacia, softening of the bones. Softening of the bones, right? Softening of the bones. Another one that we have here is chondromalacia, softening of the cartilage, right? What is cartilage? Cartilagos, right? I have another one, megaly, sorry. That's that enlargement, elongamiento, right? So in this way, we can talk about is cardiomyopathy, enlargement of the heart, agrandamiento, right, del corazón. Hepatomegaly, hepatomegaly, there's the enlargement of the liver, right, when your liver grows. Meter is the instrument for measuring. Thermometer, sphygmomanometer, blood pressure measuring device, right? So those are the basic suffixes, okay? I have two more that we can use in order to continue with the suffixes. We have the pinia, deficiency, okay? Deficiency, directly. Example, leukocytopenia, I mean lack of white blood cells, deficiency, ausencia de, carencia de, right? Pinia. And the last one is the rexis. Rexis is a rupture, una ruptura, quiebre, right? Maiorisis. It's the rupture of a muscle, right? Another one, angioresis, the rupture of a blood vessel, angioresis, okay? So those are the suffixes. Well, we have a lot of. Now, what I want you to do, I'm gonna go back just to make you see. Okay, what I want you to do, I know that it was very, very exhausting, sé que estuvo muy cansador, hasta un tanto aburrido, but that is something important that you needed to know, necesitaban saber, right? Now, I know that you belong to the healthcare area. Here I'm sure that we have doctors, that we have nurses, and we have all, obviously, personnel and professionals related to the healthcare area. Please, what I want you to do is to start writing some specific words that use prefixes or suffixes, or maybe prefixes and suffixes. Write in the chat, please. Let's start writing in the chat. Now that you know all these ones, I'm gonna go back a little bit more. So, for example, let's start working first with the prefixes, okay? I want you to write, please write in the YouTube chat. In the YouTube chat, please do it. Write all the words that it comes to your mind related to the health area. Cardio something. Neuro something. Start writing, please. I know that you can do it. Write all these words so you can, in this way, show that you understood what I was telling you. Please, can you start writing? Write, please, write. Escriban, por favor, unas palabras que sean con los prefijos, que puedan crear con prefijos. Please, empiecen a crear en el chat de YouTube. Empiecen, por favor, escriben algunas palabras, 1, 2. Vamos, empiecen a escribir, por favor. Do it. I know you can do it. Mientras tanto, volveré a recordarles que ustedes pueden escribir a los teléfonos que se encuentran en pantallas en YouTube para que puedan dar sus datos y así poder obtener los certificados relacionados con este seminario. ¿Ok? Asimismo, indicarles que si ustedes quisieran también el material, lo pueden hacer simplemente preguntando por ellos en los números que ya están en la pantalla de YouTube, ¿ok? Asimismo, si ustedes tuviesen alguna consulta, simplemente colocan en el chat de YouTube y nosotros vamos a poder aclarar cualquier duda, ¿ok? Please, continue with this. I need you to work on it. Please, do it. I know you can do it, please. Do it. Just one or two words, una o dos palabras, utilizando prefijos as well, of course, ¿ok? Vamos, empiecen. You can use the prefixes that you have. You can take a screenshot if you want to use them. I'm gonna go to the suffixes. There it is. Also, you can use a suffix, okay, to write some words, please, some specific words. Please start working on it. Write down. For example, the biology, pathology, you just have to write, okay? Please do it. Do it. I will wait for you. Please start working with it. Vamos. Coloquen, por favor, coloquen. Escriban, anímense. That it is, okay? I will leave it there. I will wait just like a minute so you can start working on it. And then we're gonna continue with the next presentation, okay? Please, check it. Write it, please, write it. I know you can do it. Okay. Well, while you are doing that, mientras ustedes van escribiendo, this is very important because in that way you will start working with autonomy, with any problem, with any pain or any disease, right? It's not necessary for me to give you the whole disease. When you know the suffix and the prefix, you can start thinking and understanding the correct way of saying any disease or pain or treatment in English, okay? That's why we are working with this. Okay. Let's continue with this. So we are going to continue with the medical vocabulary and body systems, okay? This is very important. So in that way, we need to understand how to introduce yourself to the patient. I mean, as a health professional, right? And these are some kind of introductions that I have created in order to make you do it or maybe take into consideration, okay? So, for example, we have here, this is the professional introduction. I mean, we can, if you're a doctor, you can start in that way. Good morning, could be good afternoon, could be good evening, according to the time. It will depend on the time, right? Good morning, my name is Dr. Espinosa, your cardiologist. Obviously, you can write any other one, right? Any other sub-profession, right? You can also say, I am a nurse Ramirez. I will take care of you today. right? Good afternoon, I'm your neurologist. My name is Dr. Camacho. Good morning. I am the nurse in charge of you. You can call me Nurse Flores or just Emma. If you realize in Spanish, we just say our names, right? Soy el doctor Roberto Espinosa. Soy la enfermera Emma Ramírez or Emma Flores. But in English, we use just the last name. Utilizamos generalmente el last name, el apellido. Good morning, my name is Dr. Espinosa, your cardiologist. Soy el doctor Espinosa, right? I am Nurse Ramírez, soy la enfermera Ramírez. I will take care of you today. Me haré cargo de usted el día de hoy. Cuidaré de usted el día de hoy. Good afternoon, I'm your neurologist. My name is Dr. Camacho. Mi nombre es el Dr. Camacho. Good morning, I'm the nurse in charge of you. Yo soy la enfermera que está a cargo de usted. You can call me Nurse Flores. Puede llamar la enfermera Flores, okay? Please don't forget, this is important when you talk in English. It's very important. Why? Because we don't talk about the names. We don't use the names in English. Okay, you may have seen some series related to the medical care. For example, this was a very common series, Dr. House, right? Dr. House. House is the last name, it's not his name. That's why we are using just the last name. So, cuando quieran referirse a una persona, a un paciente en inglés, es preferible decir el apellido antes que el nombre, okay? My name is Dr. Espinosa, okay? This is very important. Now, let's continue. The patient obviously will introduce themselves. For example, my name is Juan Rodriguez. I am 45 years old. Or maybe they can say, I am here for a checkup because I feel unwell. Vine a hacer un chequeo, una revisión. No me siento bien. Hi, my name is Ramiro and I have a terrible headache. Headache, enseguida lo vamos a ver. We're going to check it in a minute. Good afternoon, doctor. I am here because I have a backache that don't let me walk. Que no me permite caminar, right? Or baby, hello. I feel very sick. I have a stomachache and fever. I don't know. So, for this, you have to work with polite expressions. Oh, thank you very much. Please have a seat. Okay, have a seat. Nice to meet you. Nice to meet you. Sit down, please. Right? So you can use these polite expressions in order to make the patient feel better, at least that they feel that you can trust in you, right? In order to have a very good communication skills, it's important to follow some specific questions. These questions may be the ones that I am having here for you. They could be, I don't know, maybe a kind of following questions that you may use. But I am not telling you that these are the only questions that you may have. No, since you know this, once you know all of these questions, you may be able to do some other related to your specific area in the medical terms, right? For example, What brings you here today? ¿Qué le trae aquí hoy día? ¿Por qué viene? What brings you here today? Not why are you here? Why are you here is like very, very rude. Why are you here? No. What brings you here today? ¿Qué le trae por acá hoy día? Right? What brings you here today? Okay. Another could be, where exactly does it hurt? Don't forget that you are asking. No se olviden que están preguntando. Where exactly does it hurt? No, where exactly hurts. That is Spanish. Eso es español. ¿Dónde duele exactamente? Where exactly hurts. It's a very, very, very literal translation. In English, we use the auxiliary, right? So where exactly does it hurt? ¿Dónde exactamente le duele? What are your symptoms? What are your symptoms? Oh, very good. What are your symptoms? Oh, I have this and this and this. How long have you had these symptoms? How long have you had these symptoms? Are you taking any medication? Are you taking any medication? Sometimes we just do a self-medication, and that's not good. Or sometimes we were taking some medication, and I decided to continue going to the doctor because I don't feel very well. So, are you taking any medication? No, sir, I'm not. Are you allergic to any medication? This is very important. Before using a shot, antes de utilizar una inyección, penicillin or ampicillin or whatever, any other, you have to know if the person is allergic to any medication, right? Are you allergic to any medication? Yes, I'm allergic to the penicillin. Okay, thank you very much. So I know that I cannot give him the penicillin or give her, right? So that is very important. So here we have these questions that you can ask. What about the instruction for these patients, for your patients? These are some instructions that you may use in order to start working with them. Please lie down on the bed. Por favor, recuéstese en la cama, right? Breathe in. What is breathe in? Respire. Meta aire if you want, breathe in. Hold. Contenga el aire. Hold. Now, breathe out. Ahora, exhale. Breathe in, inhalar. Breathe out, exhalar. Right? Breathe in, hold. Now breathe out. Breathe as if you were running. Yes. Most of the time when you are sick, when you have a flu, or when you have a cold, you talk to the doctor that you have a cold, you have a fever, etc. And obviously the doctor says, I'm gonna check you, okay? I'm gonna check you out. So please breathe as if you were running. As if you were completely tired, como si estuvieses cansado, right? Take this medicine twice a day after meals. Take this medicine twice a day after meals, después de las comidas, right? Open your mouth and stick out your tongue. Open your mouth and stick out your tongue. Saca la lengua and stick out your tongue. So I can see your throat. Throat, garganta. Throat, garganta, okay? Let's continue. Tell me if it hurts or not when I touch it. Tell me if it hurts or not when I touch it. me indica si duele o no donde vaya tocando, right? Oh, yeah, I have a terrible pain there. Oh my God, yeah, that is your kidney. I don't know. Okay, so that it is. Yes and no open questions are important for better understanding. What are the yes, no questions? The ones that you start with do, does, are, or is. Are you drinking enough water? Yes, I am. Do you feel a pain here? No, I don't. Are you taking medicines? No, I am not. Those are the yes, no questions. Okay? Do you feel tired? Yes. Do you have fever? Yes. Right? Those are the specific open yes, no questions. Okay? Now, the symptoms that you may have. I have a headache. I have a headache. What is headache? Headache is a pain in your head. Dolor de cabeza, right? And obviously you can say, I have a terrible headache here in this part or here in the nape. I don't know what is happening. Or maybe you can say, I think I have a migraña, right? Another kind of headaches. I feel dizzy. What is dizzy? Dizzy. Dizzy. Like if you were drinking, right? Dizzy. Dizzy. Mareado, right? Nauseous. Nauseous means que tienes náuseas. Nauseous. Or maybe tired. Tired, right? Tired. Very tired. It's aching. What does it mean? It's aching. Duele. It's aching es duele. It's aching. Me duele. Está doliendo, right? It's aching. I cannot move my arm. No puedo mover mi brazo. And you can obviously generalize that. I cannot move my wrist. I cannot move my wrist. I cannot move my fingers. I cannot move my neck. I cannot move my neck. I cannot move my arm. I cannot move my leg or my ankle, mi tobillo, right? I fainted, and when I woke up, I was at the hospital. When you say I fainted, means me desmayé, I fainted. And when I woke up, cuando desperté, I was already at the hospital. Ya estaba en el hospital. I fainted. Me desmayé, right? My ankle is swollen. My ankle is swollen. Swollen. Wounded. Okay? That is something important. So swollen, wounded. Okay? So those are the expressions about the symptoms, but we have some more. I have a headache. What is headache? I told you, the pain in the head. I have a backache. What is a backache? Can you tell me what a backache is? A backache is a pain in your back. Dolor de espalda. I have a backache, right? Another one is I have a toothache. Tooth. I already told you what tooth is. Tooth, a toothache. I have a toothache, it's swollen. I have an earache. Earache, earache, dolor de oído, an earache. I have a heartache. What is heartache? Dolor en el corazón. But these are the ones that in which we can use ache with the body part specifically. My body aches means me duele el cuerpo. My body aches. My arm aches. Me duele el brazo. But I cannot say I have an arm ache. No puedo decir tengo un arm ache. Ahí no se puede. Estos son los que sí se pueden, ¿ok? My arm aches, my body aches, I don't know, my foot aches, my fingers ache. Okay, this aches is doler, dolor. Okay, so there's another one, pain. And I have to be very, very specific with this. What is pain? Pain is dolor. Pain, dolor. Aches, doler. In other words, pain is the noun and aches is the verb. Aches es el verbo, doler, me duele. And pain is the noun, es el sustantivo, dolor. I have a pain in my arm. Tengo un dolor en mi brazo. I have a pain in my shoulder. I have a pain in my neck. Tengo un dolor en mi cuello. But my neck aches. Me duele el cuello. My neck aches. That is important, okay? That's the difference between pain and aches, okay? I hope you understand the difference. La diferencia entre pain y aches es que pain es el sustantivo, dolor, and aches es el verbo, me duele. My arm aches, me duele el brazo. I have a pain in my arm. Tengo un dolor en mi brazo, okay? I hope you understand this very well. Now, before we go, please, I would like you to participate. Me gustaría que participen, por favor. So, do you know another aches? Si tienen otros dolores, another pains? For example, I don't know, a shoulder pain, right? How you can say my shoulder aches, right? My shoulder aches, right? ¿Qué otros síntomas ustedes pueden colocar? Tell me. What other symptoms can you write? Please write it in the chat. Escriban en el chat de YouTube, por favor. Escriban en el chat de YouTube. Si pueden colocarlo, por favor. Algunos otros síntomas que ustedes vieran que no está acá. Si quieren repetirlo, no hay problema, pero coloquen, por favor. Coloquen, estoy esperando. Vamos, mientras tanto, indicarles de que pueden llamar o comunicarse con los números que tienen ahí en el chat, en la pantalla de YouTube, para poder recabar mayor información y poder dar sus datos para poder obtener los certificados correspondientes y asimismo todo el material que estamos utilizando, ¿ok? También decirles que si tienen alguna consulta simplemente pueden hacerlo, no hay ningún inconveniente. ¿Alguna otra consulta? Vamos, escriban. Algo más algún otro síntoma, any other symptoms that you may know, que ustedes sepan. Vamos, coloquen, por favor. Coloquen. I will be very grateful to listen to you, to read to you by the YouTube. ¿Ok? Vamos, coloquen, por favor. Yes? While you are doing that, let's continue with this. Do it. Todavía no voy a continuar. Vamos, escriban algo. Escriban un dolor, qué sé yo, que ustedes consideren que es correcto. I have a pain in my arm, or I don't know, my nail aches, I don't know. Do it, please, do it. Okay, while you are doing that, please write it. You may write it. Okay. So, while you are doing that, please don't forget to write down on the chat. Por favor, escriban en el chat de YouTube. Es muy simple, simplemente es colocar algún dolor específico que ustedes quieran colocar y ya, okay? Obviously in English. Now, let's continue. Let's express in some sentence, some signs. This is for the professional of the health care, not the patient. The patient has a fever of 39 grados, okay? 39 degrees, obviously it's too much, right? What is the average? ¿Cuál es la temperatura normal? Can you write it? Pueden escribirla por favor en el chat. Write it, please, write it. We have also the blood pressure is elevated. The blood pressure is elevated. What is it? La presión sanguínea está elevada, right? The patient feels dizzy. Se siente mareada, right? The patient is throwing up. What is throwing up? It's to vomit. The patient is vomiting, is throwing up, vomiting, okay? Throwing up. Very good, Luz Maria Porto. Stomachache. Thank you very much. I have an eye ache. Oh, great. Super. Thank you very much, Rafael. Thank you. That is the way I wanted you to work. I have a finger ache. Great. I have a finger, or my finger aches. Leonela, stomachache. Very good. Stomachache, very good. Thank you very much, Luz Maria Porto. Thank you very much, Leonela Gutierrez. Stomachache. The normal or the average is 36.5 degrees. Thank you very much, E. Roque. 36.5, 36.5 degrees is the average. The temperature, the average temperature. Very good. Thank you very much, Gabriela. Thank you very much. 35. Thank you very much. The patient has fever. Oh, thank you very much, Adriana. The patient has fever. Thank you very much. Catherine, I have a backache. Oh, excellent. I have a backache. Very good. Another one, Rafael. I have a finger ache. Yes, I have a pain in my right foot. That is excellent, Dennis. Tengo un dolor en mi pie derecho. Very good. Leonela as well. My chest. Mi pecho, right? I have a headache. Luis Espada. Thank you very much. I have a knee pain. Oh, great. I have a knee pain. Tengo un dolor en las rodillas, o dolor de rodillas. Thank you very much, Tafu. Jennifer Lopez. I have a leg ache. Okay. I have a leg ache. Well, it's not so common, but very good. Dennis Gomez, my chest aches. That is Better. My chest aches. I have a nail ache. Very good. I have a nail ache. I have a sore throat. That is excellent. What is sore throat? That is something that I forgot to tell you. Sore throat es dolor de garganta. Thank you very much, Dennis. Jessica Espinosa, dolor en los ojos. My eyes aches. My eyes aches. Or I ache, right? That it is. I'm still reading. Sigo leyéndoles, okay? I have a finger ache. Adriana has fever. Very good. I have an elbow ache. Yeah, could be an elbow ache. Dear Dennis. I have a sore throat. Very good. I am nauseous. As I'm telling you, tengo náuseas. Very good. I have a nail ache. Yeah, I have a nail ache. It's okay. Very good, Rafael. I have a pain in my knee. Yes, tengo un dolor en mi rodilla. An abdominal pain. Abdominal pain. Or my abdomen aches. That should be Catherine. Very good. My forearm aches. That is excellent. My forearm aches. Very good. Dolor de cabeza. Yes, dolor de cabeza es headache. Very good. Cardiologist. Excellent. Neonatologist. Melanoma. Oh, very good. Lo que les había pedido. Let's continue reading. Neonatology, melanoma, Sharia, psychosomática. Yeah, psychosomatic is psychosomatic. Psychosomatic. Thank you, Raúl Antesana. Psychosomatic. No sé si leo bien. Iridología. Iridology. Laparotomy. Yes, laparotomy. Very good. Intravenous, very good. Anna, thank you very much. Dennis Gomez as well. Tachycardia, very good. Endoscopy, visual endoscopy. Visual endoscopy, okay, visual endoscopy. But it is redundant. Ya es un poco redundante because endoscopy is a visual study. So endoscopy is just that, right? Thank you, Leonela. Jennifer, pathophysiology. Yeah, pathophysiology. Very good, pathophysiology. Intradermic, yes, intradermic is very good. Cardiology, neurology. Thank you, Dennis. Anna, hypertension, yeah, very good. Geography, okay, geography is okay as well. Electrocardiogram, biology, transformer, no. But okay. Hyperthyroidism, yes. Imelda, thank you very much. Hyperthyroidism. The neurology emergency, thank you, Leonela. Imelda, neuroscience, yes. Neuroscience. Cardiología, Catherine, yes, cardiology. Yeah, Romina, hypercalcemia, very good. Cardiology, cardiopathy, the cardiólogo hospital. The hospital cardiologist, maybe. if you want to make me translate it. Electrocardiograph, the electrocardiograph, and the electrocardiogram. Electrocardiogram. Pulmón lax, hígado, yes, very good. Mariana Martínez. It says, let me write it. ¿Cómo se dice? Ajá. ¿Cómo se dice colitis? Okay, very good. That's a very good question. It is the same as in Spanish and in English, okay? It is colitis. Colitis, okay? Colitis. ¿Se puede ver después la clase? Don't think so. You need to ask for the material in order to watch it later on, okay? Let's continue. Here I have. ¿Cómo se dice tengo náuseas o vómitos? Okay. I feel nauseous. Tengo náuseas. I feel nauseous. Okay. I want to vomit. I want to throw up. I want to throw up. Okay. Tengo náuseas, ya está. I have an ankle pain, very good. I have my bones. I have my bones means yo tengo mis huesos, but I have a pain in my bones. Tengo un dolor en mis huesos. I have a gum pain. Yeah, very good. I have a gum pain is also very good. If you understand a gum pain, yes, do you understand? A gum pain means this. The gum are the encías. A gum pain, dolor de encías. Okay? Very good. Let's continue. Let's continue. And so on. Very good. Now, let's continue. Well, thank you very much for working with me. So, arrhythmias, dyspnea, I cannot understand, Noemi. You're at dyspnea, SK, arrhythmias. I have a headache, very good. My patient has a muscle pain, very good. Excellent, very good. Let's continue, let's continue. Well, thank you very much. So, we are going to continue with some pneumonia. So diagnosis, sorry. So we can continue. For example, here you have a pneumonia. This is a case of hypertension. Es un caso de hipertensión, right? Es un caso de hipertensión. Sorry, but I think I have a problem with the YouTube. Just let me check. Something is... Yeah, now I got it. Thank you very much for waiting for me. Buenas noches, Da Hanko. Thank you for logging in. So, we are continuing with the diagnosis, okay? Here says you have a pneumonia. This is a case of hypertension. Also, you have just a flu. What is flu? And this is important. A flu is just here, right? Gripe, flu. Cold, resfrío. That's what it calls. It is cold, resfrío, flu, gripe. Okay? So that it is. You twisted your ankle. Twist is like torcerse, right? You twisted your ankle. This is a case of arthritis. arthritis, right? That it is. So those are some kind of diagnosis. Now, let's continue with you, professionals in the healthcare area. Dear guys, please, could you write some diagnosis? I know you know. Yo sé que ustedes pueden hacerlo, ¿ok? Escriban algunos diagnósticos, ¿ok? Mientras tanto voy a ir respondiendo. Por favor, díganme, escriban algunos diagnósticos. Write some diagnosis, ¿ok? One person is asking here, ¿cómo se dice apendicitis? Right? Appendicitis is the same in English than in Spanish. Okay? Appendicitis is the same as in Spanish. Okay? It's the same in English and in Spanish. Appendicitis, that it is. Okay? Appendicitis. ¿Quién me preguntó eso? Vamos a ver. Catherine, that is appendicitis. The same, appendicitis, okay? Very good, thank you very much. It says here, the patient has a chronic gastritis. Excellent. Very good. That it is. Super. Another one. ¿Cómo se pronuncia apendicitis? Okay, it's the same. I already talked to you a little bit before. Appendicitis. So this is you're gonna listen. I have to tell you this. You're gonna listen appendicitis. Van a escuchar esos dos. It depends on where the patient comes from, okay? Where the English comes from. So there are some kind of differences. But don't worry, you can say appendicitis or appendicitis. I have here, you have a glioma. Very good. Thank you, Jennifer. You have just blackheads, okay? Very good, you have just blackheads. Another one. Okay, here I have another question. It says, ¿cómo se pronuncia gastroenteritis? Gastroenteritis. Gastroenteritis is the same as in Spanish. There is no differences, okay? The pronunciation is gastroenteritis. Gastroenteritis, okay? Gastroenteritis, okay? ¿Quién me preguntó eso? Here is the Hanko, that is done. You twisted your twist. Very good. You twisted your twist. Excellent. Excellent. Very good. Excellent. Another one. Let me see. I am answering some of your chats. Thank you. Very good. Thank you very much. Thank you very much, Eroke. You have just blackheads. Very good. Now, let's continue. Treatments. Treatments. Let's talk about treatments. So you have to prescribe. As doctors, you have to prescribe. You need to give them some antibiotics, etc. So you can work with this. Receta. That's what I was about to forget. A receta is a prescription. Okay, don't forget, it's not a recipe. Okay, recipe es receta as well in Spanish, pero es una receta de cocina o cualquier otra receta. But una receta médica is a prescription. Prescription, okay? This is very important. Tratamientos, treatments, okay? Treatments. I will prescribe antibiotics. That's one of the treatments, right? I will prescribe antibiotics. You need to rest and drink plenty of fluids, plenty of liquids, right? You need to rest and drink plenty of. Plenty of es una gran cantidad de, mucho. Don't forget that plenty of is very formal because you are having a formal conversation with your patient, right? If you want, you can say a lot of water, much water, but there is plenty of fluids. Please, it says here, take these pills 1 every 8 hours. That is the most common, right? Please take these pills 1 every 8 hours or after meals. Or maybe you can say, take a rest and eat soft, white food. And this is very important. Soft, white food means comida blanca y blanda, right? Soft, white food. Could be just white food or soft food, but if you want to tell both of them, soft, white food, okay? That is also important. Come back in 1 week. When you are giving instruction or treatments, okay, come back in 1 week so I can check how you are improving, right? Cómo vas mejorando, right? Or how is your improvement? How is your develop of your sickness? Cómo se va desarrollando la enfermedad, right? So come in 1 week. There is some of other kind of treatments that you can say, right? This is something that we have already talked. It says, good morning. My name is Dr. Espinosa, you're a cardiologist. So this is the way you have to talk too, right? But it's important. You have an ear infection. Very good. That is excellent. You have an ear infection. Thank you, Luz Maria Porto. You need to follow a healthy diet. You need to follow a healthy diet. You need to follow a healthy diet. Very good. That is also good. Well, thank you, Gabriela. So let's continue. This is a clinical communication, right? What do I mean? This is when you are in the hospital, right? In the hospital, we already have talked about it. So, but why I am repeating this? Because I need you to follow this conversation, because now we're going to work a little bit with your conversation, okay? So, for example, imagine that you are working, well, most of you may be working in a hospital, so not just in a consultory. So I want you to take the doctor's place and start talking. I want you to write now, starting in that way. You can choose one of those, right? For example, good morning, my name is Dr. Espinosa. I am the internist doctor, soy el médico internista, right? Could be you have an ear infection. Yeah, very good. So in this way, you have to continue. What else you can talk about it? ¿Qué más pueden hablar acerca de ello? ¿Qué más pueden decir? For example, I can say, I am Dr. Espinosa. I am your cardiologist, and I'm gonna do some studies about how you are going with your heart. Please, I want to check you. Please sit down. I'm gonna see how it is. I'm gonna use the stethoscope. I don't know. I'm gonna listen to your heart, and are you continue having the pain? I don't know. You know more than me how to work with the patient. Ustedes saben más que yo cómo trabajar con el paciente. So this is for you to continue the conversation. So start like this and continue working. Please, can you write in the chat? ¿Pueden escribir en el chat, por favor? Escriban en el chat. Meanwhile, I will be reading this. This is good morning. My name is Dr. Espinosa, your cardiologist. Today, I'm going to start working with you some studies that I'm going to do with you. I don't know. Ok. Acá me preguntan cómo se dice consultorio médico en inglés. Ok. The consultorio médico, it is just a medical office. Could be medical office. Okay. Medical office. Come on, start reading, please. Writing. Continue, please, continue. You can say medical office, doctor's office. Also, there's another way to say doctor is physician. Physician también es doctor. You can say physician's office, doctor's office, medical office. It depends on what you want to say, right? If you have a specialization, si tienes una especialidad, you can say with the specialty. For example, cardiologist office, or cardiologist, just that, or cardiologist medical office. I don't know. It will depend on you, but the most common is doctor's office, medical office, or physician's office. Okay. Okay, let's read some of yours. Hello, my name is Doctora Gabriela. I will be taking care of you today. Thank you very much. Hello, I am the nursing assistant. I'm going to take your vital aids. Oh, yeah, your vital signs, sus signos vitales. I think you want to say that. Your vital signs, right? Your vital signs, Alba. Then, my name is Gabriela. I will be taking care of you today. Here I have another one. ¿Cómo se dice paro respiratorio, si es que no estoy equivocado. Ok, paro respiratorio. It's the respiratory or the breathing arrest. The breathing arrest or a respiratory arrest. Es un paro respiratorio, right? That it is. And here I have something else. I don't know. I didn't read it. ¿Cómo puedo decir te voy a canalizar? Ok, te voy a canalizar. Ok. I don't know how to say te voy a canalizar, but to hacer un canal is to make a channel. I'm gonna canalize you. I'm gonna canalize you. I'm gonna make a channel into you. That is another one, okay? That it is. That it is. I hope I answer your question. Yeah, I'm gonna canalize you or channel you is the same. Okay, let's continue now. Let me go to this. I'm checking this. Very good. Vital signs. Vital signs. ¿Cómo se dice signos vitales? Vital signs. Hi, I'm Dr. Gomez, and I'll take care of you today. Tell me, how are you feeling now? Very good. How are you feeling now? Thank you very much, Miss Dennis Gomez. Thank you very much. And it says vital signs. Okay, vital signs. Now, let's continue. Let's continue. Let's continue. We're having just like 10 minutes. It says here is just an answer of what you are asking, right? My name is Sarah Green. I am 32 years old. I came because I am not feeling well. I don't feel very well since yesterday. I have a terrible pain in my back, and I have a toothache on my back hurts. I feel dizzy. So and those are the answers that maybe the patient may have, right? So those are the that is. Maybe I'm going to put in an IV. Yes, but canalize. I don't know what you mean in canalize, because IV means intravenous, right? Intravenosa. That is canalize. If it's canalize, that is this, because that is something with related with putting something inside, right? That's why I'm telling you, you know more than me in terms of what you do, and that's what you may be specific. But thank you very much, Ms. Gabriela. Yeah, I'm going to cannulate you, as that is what I told you. So let's continue. Yes, Dennis, I told you vital signs. That it is. Well, thank you very much for working with me, for telling me all of these examples, and to participate. That was very good. That was very good. We're gonna continue now. Let's continue. Let me read this. Yes, Denise, I told you, signos vitales and vital signs. I'm going to cannulate you. Yes, that it is. That's what I told you. I'm going to channel you or cannulate you. That's what I tell you. I told you. So let's continue with the medical reports. But thank you very much, Dennis Gomez. That was very helpful. Very helpful information. So in this way, we're going to continue with reading and interpreting medical records, or records, sorry. There's a big difference between records and records, right? Here we are. Let's start working with some medical abbreviations, and that is what you have now. No, thank you, Ms. Dennis. Medical abbreviations. This is also very important. What is the main objective, the main goal? To understand and recognize the most frequently medical abbreviation in patient charts. Obviously, I'm not telling you that you don't know, right? So the prescriptions and hospital records, in this way, I'm not telling you that you don't know this abbreviation. You already know. But let's see if they change from Spanish to English. So, because you have to remember that we are working in the hypothetical case that you are working in an English hospital, or maybe an American hospital, or maybe you are talking to an English patient. So it's important to know how to speak and how to read as well, obviously to write. So in this way, at the end of this little subject, you will be able to recognize all the abbreviations or that you know, the most frequently medical abbreviations, okay? That is what we are going to do now. And we have the BP, that is blood pressure. I don't know if in Spanish is the same, right? Presión arterial or presión sanguínea, right? Sorry, presión sanguínea. The blood pressure. The HR means the heart rate. Temp is temperature, or just T. Temperature, just T. Okay. We have the WNL, the within normal limits. Within normal limits, that's dentro de los límites normales, o los parámetros normales, right? Within normal limits. Within normal limits. The DX is the diagnosis. Diagnosis. The DX is very important, diagnosis. The TX is the treatment. Treatment. The RX is the prescription. RX is the prescription. The HX, the history. I mean, you need to write the history, right? FX means a fracture, when you just break something, right? A fracture, that it is as well. We can continue. Time and frequency. Once a day means QD. QD, once a day. QD. Bed, BID, twice a day. Twice a day. Maybe you want to copy, I don't know. I will go back in a minute. QID, what is QID? 4 times a day. 4 times a day. PRN, as needed. As needed, a medida que vaya necesitando, right? As needed. As needed. Stat. Stat means immediately. Immediately. Immediately, right? Immediately. Let's continue. Hospital and clinical settings. The places, so the ICU, the intensive care unit. Well, before going to the clinical and hospital settings, so let's continue with the time and frequency and the general abbreviations. So I would like you please to tell me some other abbreviations. Can you please? Maybe you know some others. you can tell me and I can work with you. So tell me which other abbreviations in English you know. Please. Do it. I will be waiting for you. Mientras ustedes escriben en el chat de YouTube, indicarles que ya estamos a 5 o 3 minutos de terminar. Por favor, yo les pediría que si es que necesitan comunicarse todavía con los números que están en la pantalla, por favor lo hagan para poder dejar sus datos y recibir toda la información si se quieren y obviamente los certificados correspondientes, ¿ok? Acá tengo uno. Signos vitales, vital signs for Remy comment for se diría her heart rate is within normal. Yes, excellent. Yes, Alba, that's the way. Her heart rate is in the normal limits. Very good. PhD, we know what is PhD. I don't know what you mean by PhD. PhD is a name that we know, right? It's an acronym that we know to have the profession you have in PhD, but I don't know if you refer to that or what you refer. Please, I would like you to tell me, Roque, so I can help you. If you are talking about a medical, it talks about a dual degree program. Yes, that's what maybe you are talking about, a PhD or MD, a dual degree program that we use, that you may work with. It's a strange fish, yeah. It's the one that I know, that I can tell you. Yeah, that is health-related field, right? Biomedical science, clinical science, or public health. That it is, right? I hope I can answer your question. Okay, so you are talking about Doctor of Philosophy. Okay, that's another one. Yes, very good. Doctorado, yeah, obviously it's doctorado, but we're talking about some other ones. Antibiotics and painkillers. Yes. Do you know what a painkiller is? Painkillers, calmantes, right? Painkillers, calmantes. Thank you very much, Jennifer. That it is. Well, we're gonna stop here. We're gonna continue with the next time and frequency. Here, hospital and clinical settings, the day of tomorrow, okay? We're gonna continue tomorrow with that. It's already time, and I am very, very happy to have you here in this seminar, in this, I think this is a workshop, better called workshop. And well, we will continue the day of tomorrow. Here you are working with Somos, MPO, okay? I'm gonna write that, MPO, and I'm gonna answer that tomorrow, okay? I'm gonna answer that tomorrow because we don't have more time. That it is. We have CXR, very good. Oh yeah, chest X-ray, good, very good. Thank you very much. Muchísimas gracias. Muchísimas gracias. Estamos a un minuto por estar acá en este seminario. Y bueno, pues continuamos el día de mañana. Los espero a todos, que todavía falta mucho por aprender, ¿ok? It was a pleasure for me to be with you. Thank you very much, and I will see you tomorrow. Have a good day. Bye-bye, guys. Bye-bye, doctors. Bye-bye, bye-bye.